Good afternoon. I'm Peter Kovacs. I'm the editor of the Advocate and the Times-Picayune, and welcome to our virtual town hall with Governor John Bel Edwards. The governor's rocking a seersucker suit today. So,
Well,
we
Peter,
appreciate you
I'm
being
told today is National Seersucker Day.
Okay. Well, I didn't get the memo, and so I'm underdressed. Anyhow, it's great to be here. We are thankful to our sponsor, AARP, and before we get started, here's a brief message from them. It's interesting.
Thank you, Joseph.
AARP Louisiana would like to thank the Advocate for hosting this important conversation with Governor Edwards. We'd also like to thank the Governor for his leadership during this crisis. Dealing with the coronavirus pandemic over these past few months has certainly been challenging, but especially for older adults and for people with underlying health conditions that put them most at risk. Many are more dependent on caregivers, family, and friends than ever before to help get the food, medicines, and supplies they need to help them safely shelter in place. So AARP wants to take this time to thank all of those who have helped in this time of great need. From the food banks and senior centers to the volunteers calling folks in their homes to check on them and keep them company, thank you. To the pharmacists and grocery store clerks, to the doctors and nurses, to everyone on the front lines helping to keep us safe, thank you.
Welcome back. The governor didn't have a press conference today, even though he put on his seersucker suit, so maybe he could start out by telling us how the state did in the last 24 hours.
Sure, Peter. So as it relates to COVID-19, the daily report that LDH put up on its dashboard today at noon, we're reporting 442 new cases across the state on 9,553 tests. So that's about 4.6% of the tests were positive. That brings the total number of COVID cases since the beginning to 44,472. Unfortunately, we are reporting 19 additional deaths today. The total deaths, 2,874. And relative to yesterday, there are 4 more people in the hospital and 5 more people on ventilators around the state of Louisiana. And I'll tell you, that's the first time in quite a while when we had more people in the hospital than the previous day. But it's a relatively low number, but it bears watching very closely.
Okay. When do you get these? They give this to you in the morning when you
Well,
get to work?
sometime around 10:30 in the morning.
Okay.
I'll normally get them, and then they'll get posted to the website a little closer to noon.
Mm-hmm.
So I don't get them much more
Before that.
much
Okay.
before the public, but just a little bit.
Okay. Well, let's start out with a question from Lauren of Metairie. And she says, in regards to fall weddings, what size groups can gather to celebrate a wedding? Should a big wedding party of 200 to 300 people consider moving to next year? Yeah,
it's too early for me to say what the fall is going to look like, not just with respect to weddings, but I'm hopeful that we're going to be able to ease restrictions as we move forward, and that we won't have to go backwards on that. And I really am not able to answer the question because there's no guarantees here. The virus is still very much in control, and we are not. And it's my hope, and quite frankly, it's my expectation that we're going to move forward, ease restrictions without having to go backwards. But this ties into other questions I get. What is fall football going to look like? And I just don't know the answer yet. But outdoor activities are more safe than indoor activities, and I don't know whether she's talking about an outdoor wedding or not. Of course, you always have the weather variable there. But until we have an approved therapeutic treatment and a vaccine, I would encourage people to consider outdoor venues anytime they possibly can, because they're just 95% safer than the same activity indoors. And so I would just offer that for her consideration. And I'm not going to recommend that she put off, getting married into next year. But we do know that we're in a new normal until such time as a vaccine is developed, mass-produced, and then made available to some large segment of our population. Don't know exactly when that's going to be, but next year is a better bet than this year for that.
Oh, okay. Well, you never know if love can wait.
That's right.
Donna from Baton Rouge says, when can immediate family members visit nursing home patients?
Yeah. So that Donna in Baton Rouge, would that be my wife or? Don't
I,
know.
I don't know.
Might be.
I can show you her email after that, and you can decide.
You know, this is a tough question. One of the very first things we did when we realized we had coronavirus in Louisiana, and in fact, we announced it here in this room the day that Jerome Adams, who's the Surgeon General of the United States, Vice Admiral in the U.S. Public Health Service, and Surgeon General, we were going to stop visitation to nursing homes, to prisons and jails, because we recognize that congregant settings or those settings that are most likely and conducive to spread. But more than that, nursing homes are also those settings where people are likely to have the worst possible outcomes from COVID-19, both because of their advanced age. A good percentage of those folks in nursing homes are 65 or older, and many of them have one or more comorbid chronic health conditions that predisposition them to have a poor outcome. And we haven't gotten to the point where we feel comfortable that we can allow visitation in person outside of extreme circumstances, and typically that's end-of-life type visits, because we know that the congregant settings are where we're seeing a substantial, not a majority, but a considerable part of the cases that we're reporting on a daily basis. So we're working through that to try to figure out when we can do it, and understand it's not just visitors that we're worried about. So we are working very hard to get 100% of all of our nursing home residents tested, and to test staff members relatively frequently, because that's how the disease actually gets into the nursing home. Somebody has to bring it in there. But the Office of Public Health is working this in conjunction with the CDC, the folks in Washington, and the Nursing Home Association to figure out when we can safely do it. We know that nursing home residents want to see their loved ones. They miss them. And it's a painful thing, but I do hope people understand that it's motivated by the very best of intentions. And as of right now, the counsel that I'm getting from the Office of Public Health says it's too early to lift that restriction.
Okay. Brian from La Rose says, will all the protesting cause another pandemic?
Yeah, it's hard to know what the protesting will cause. The good news is the protests are happening almost exclusively outdoors, which are inherently safer. And quite frankly, when I look at the protests, I see a number of people wearing masks. Some are not, obviously, but they're all too close to one another because we don't want you closer than 6 feet to anyone who's not part of your immediate household. We do want you wearing a mask when you're outside of your home and so forth. But I don't know if we're going to see that spike. I pray that we don't. We are encouraging people to wear their mask, keep their distance. We're also reminding people, if you're vulnerable, same conversation I just had about the nursing home residents. If you're in that vulnerable category, you shouldn't be going to a protest. You shouldn't be going to any crowds. And if you go to that protest, and you need to understand that if you live with someone who's vulnerable, there's a chance you're bringing back that virus to them. And so we're asking people to be extremely careful about that. And you know, I pray that we don't see a spike. We now know that we didn't see one because of Memorial Day. And there was a lot of talk about that, but you know, we will see. I pray not.
Okay. Gustavo of Baton Rouge asks, when are evictions going to resume? I don't know whether that means he's for evictions or against evictions.
Well, we, as you know, in a proclamation, we suspended many legal proceedings, including evictions. And as I've mentioned, I think on each of the previous shows that we did, that we certainly didn't and can't suspend the obligation to pay rent. But as of I believe it's the 15th of this month, we will be lifting those legal suspensions, including evictions. And so what we're encouraging people to do is obviously pay their rent if they possibly can. If they can't, pay as much as they can, and then if they can't meet their rent obligation in full, for whatever reason, to engage their landlords in conversation so that it's not a surprise. and that they do everything that they can to get current on their lease obligations as soon as possible.
I see. Okay, Glenn from Baton Rouge says, when will elderly living in assisted living be allowed to seek medical attention outside the facility and be allowed to return to the facility?
Okay, quite frankly, I don't know that I'm going to be able to answer that. I wasn't aware that they weren't able
To return?
to seek attention outside the facility.
Okay.
We've lifted the restrictions that we put onto non-emergency medical and surgical procedures through the Office of Public Health, and so those procedures are available to people now. And we also lifted any restrictions that we had on the availability of purely elective procedures as well. So I'm not aware that and it may be a policy of that particular home. If it's a policy of the Office of Public Health, I'm unaware of it, and I'll have to get an answer back to you on that.
Okay, well, we've done this, this is the third time we've done this. The first time you didn't know the answer to something, so I'm impressed with that. What would you have to say about the numbers of contact tracing, the participation rate that you announced the other day?
Yeah, well, so there's a lot of variables here, and obviously, you would love to be able to make contact with 100% of the people who test positive, have a good conversation with those individuals where they can identify and give you enough information so that you can then contact everyone who came within close contact with that individual while they were contagious, which is up to 48 hours before they ever developed a symptom. And so you got to get them to remember those things, give you the information in enough detail that you can identify and then contact those individuals. So that's difficult, not because people aren't trying, but I mean, just to go back in your mind, and if somebody asked
wouldn't
you,
be able to do it,
everybody
yeah.
that you were within 6 feet of for 15 minutes or more, you wouldn't have to mention me, by the way, because we're more than 6 feet apart. But that's difficult. And then you start making those calls to those individuals that are identified, and quite frankly, some percentage of those folks see the number on their phone. It's not a number they're expecting. They won't answer. So we're trying to get them to get the message and call them back and so forth. But we are making contact with a lot of folks, and we're missing a lot of folks.
yeah.
But I can tell you the effort is very much worthwhile because the degree to which we're successful, even if it's not 100%, it is going to help us keep cases from spiking again.
Okay. Do you I mean, if I got a number, when I get a call from a number I don't know, I don't answer it.
Well,
do you,
and
do you
you may have-
text them when if no one answers, do you text them or what?
Well,
do
they
you- what do you-
typically leave a message on the phone if they can. I do think that if they can identify someone with a mailing address, they will send letters as well. But yeah, and texting, I don't know that I know the answer, but I can imagine if they believe they're calling a cell number that they will
They would text
send a
them,
text as well.
Okay. Mary from New Orleans says, why are you continuing to paint a rosy picture of all the national reports include Louisiana in states that are continuing to rise?
Well, first of all, I try to paint the most accurate picture that we can. We give the numbers every single day. We don't hide those numbers. We don't shade them. But the increases in cases that we are seeing to a very large degree correspond to an increase in testing. And, you know, for example, I was telling you a while ago that we had 442 new cases, but we only had 4 additional people in the hospital. And so it's always a mixed bag. But today we have a total of 553 in the hospital. On May the 19th, it was well over 1,000. So we are doing better in a lot of respects. We're also doing better because it's a smaller percentage of the tests that are having a positive result. And we are well under the 10%, which is a World Health Organization standard and a CDC standard for showing significant improvement. And there was a time when we had the highest case growth anywhere in the country and one in the world, perhaps, and we were up at 40% positivity. And we haven't been anywhere close to that. In fact, we're down less 10% since the inception now, if you look at all the tests and all the positives. So we are doing better, but we've also been very, very frank that we've had a couple of regions that we're watching very closely. particularly up in the Monroe area, but also in central Louisiana, in Alexandria, and down in Lake Charles. But the numbers are really small, but we are seeing some increases in cases and hospitalizations. And when you do 100% tests in congregate settings, you are going to find a lot of cases. And by the way, a lot of those cases are totally asymptomatic.
Yeah.
But those are issues too, because they can spread. But the asymptomatic cases are not going to place a demand on your hospital. So there's a lot of data out there. And what I will tell you is we're doing much better than we were several weeks ago. There's still a lot of COVID in Louisiana. We have a long way to go. But thus far, we have been successful in terms of our stay-at-home order and then our phased approach to reopening our economy.
Okay. Casey from Baton Rouge asks, what would have to occur that would prompt you to roll back some of the reopening, like to go back to phase 1 or phase 0 or
Yeah,
whatever?
well, if we saw through the data that we are growing in cases to the point where we are jeopardizing our ability to deliver care, for example, and whether that's happening in discrete locations or whether it's more broadly happening around the state, those sorts of things. And look, I huddle with our Office of Public Health team just about every single day to look at the data and get their best guidance on things. They are in turn talking with the CDC and the folks at CMS and so forth. At the federal level, we continue to adhere to the White House coronavirus task force plans and the White House phased approach to reopening the economy. So we're looking at all of that, and I can't tell you exactly what it will take. I can only tell you we're not even approaching that right now because, generally speaking, we're still doing much, much better.
Now, I know you're a family man, so this might not be part of your life, but Nicholas of New Orleans asks, are strip clubs included as bars in phase 2, or do they fall under live entertainment?
Well, it's my understanding that in phase 2, we reopened bars, and that includes gentlemen's clubs, or what was it?
He calls them strip clubs in his
yeah.
question.
Yes, and so I believe that those are open because it's well, the answer is yes. I can't tell you that they all reopened, but
They're allowed to reopen.
They're allowed to be
Right,
open.
right,
So I don't know what was it, Nicholas?
Yeah, and I know that you probably haven't personally gone to check.
I have not. I'm not doing those inspections.
So, okay. Donna from Lake Charles says, when is Visitation going to open up for juvenile detention centers, secure and non-secure?
Yeah, and we're working on that as well. Obviously, we're trying to keep everyone in congregate settings safe. I am happy to tell you that we've had 32 children total who were in secure care who've tested positive, all of whom have recovered. We don't have anybody currently positive or in the hospital or anything like that. And in fact, young people typically fare much, much better if they get COVID-19. That has proven the case to be with 100% of those juveniles that we have in our custody. So we're working through that. I've talked to Dusty Bickham, who is over the Office of Juvenile Justice. He and his team look at this all the time, and they're trying to figure out with the Office of Public Health when they can resume visitation. It is important for young people to remain connected to their families, but it's also important that we not introduce COVID into these settings as well. And one of the things that's going to continue until such time as these restrictions are lifted on visitation, they're going to have much more liberal access to phone calls, to Skype and FaceTime and those sorts of opportunities to interact with their families.
Okay. Clay from New Orleans asks, do you have plans to defund the Louisiana State Police?
No.
Okay, that was a simple answer.
That's a very simple answer.
What's your view? You're from a law enforcement family. What's
Yeah.
your view of the defund the police movement?
Yeah, well, first of all, the term, as I understand it, and of course I didn't develop the plan, but as I understand it, the vast majority of this is not even talking about defunding the entirety of police agencies, but it is to reduce funding to police and have police do police work take the money that you defund them by and increase the funding in other agencies like social workers, for example, so that police officers aren't out on the streets being social workers and referring individuals to various organizations and for help. But my emphasis is not on that. I am from a law enforcement family, and by the way, I support law enforcement, but that does not mean that I support what I've seen on TV with these obvious unreasonable uses of force that we saw in Minneapolis, for example, and elsewhere. And quite frankly, I have not had a single police officer or law enforcement officer tell me that they believe that was a reasonable use of force. So I think we can support law enforcement generally and be very, very critical of particular instances of abuse of force, and that's entirely appropriate. And so what we have to do as governmental leaders is try to make sure that we have law enforcement that is properly trained and supervised, that the selection process of who gets to become a police officer, who gets to remain a police officer, all of that has to be looked into, so that we very rarely see the types of things that we have seen too frequently, like the murder of Mr. George Floyd.
Okay. Abigail of New Orleans says, when can we expect to hear about the state guidelines for reopening of schools?
Yeah, very soon. I've been talking to Commissioner Kim Hunter-Reed and our new who's the higher education commissioner, and then also to Kate Brumley, Dr. Brumley, who is the new superintendent of education. And we will be making announcements soon. I can tell you parents and students and teachers and everyone else should assume that we are going to open our schools on time, K through 12 and higher education. We're going to open our campuses, and we're going to do so in a way that is safe. It won't look like previous years in many respects, and we're going to outline what that's going to look like. But we're going to open across the state on time and in a way that's safe, and we will be making specific announcements with much more detail in the very near future.
Okay. Brittany from Baton Rouge says, how are we supposed to return to work and school comfortably, knowing the virus is still out there with no cure? We're putting our life at risk for $1.
Yeah, well, you know, that's a challenge, and everybody has to determine their individual circumstances, what their risk tolerance should be. For example, are they in a vulnerable category and so forth? When they go to work, is their employer engaging in all the things that he or she needs to do to keep them safe, and so forth? And there's so many variables there, but everybody has to make this determination for themselves. But I will tell you, we have to move forward and continue to open our economy as we are able, because it's that too is important for people and their not just their livelihood, but we have to continue to move forward. But we're not going to do it in a way that is unreasonably dangerous. And we still continue to tell people, if you're in that vulnerable category, understand you are safer at home. You shouldn't be doing things just because they're open. But this really applies to everybody. If not just at work, if you want to go to a restaurant and eat, and you get to the door, the window, and you see that they have too many people too close together, and you don't think it looks safe, don't go there. Go somewhere else, or get a meal and go home. But everybody is going to need to weigh these risks for themselves. And I would encourage them to go to the LDH website, and at the bottom, they can actually download a survey that they can answer, and it will tell them what their particular risk factors are and some of the things that they should take into consideration.
Okay. Rachel from New Orleans says, will you veto HB 197, a bill that disproportionately disenfranchises people of color who are protesting the kind of environmental justice that leads to poor public health outcomes in their communities? Yeah,
so we have that bill under consideration. I will sit down with my staff, I think tomorrow, to go through that one. We review them by batches, and that was one of the last bills sent to me, and I haven't reviewed it yet. But there will be an answer forthcoming on that in the very near future. It is one, I will tell you, it's a bill that I have concerns about, even though I believe the author, who is Representative Zarang, was well-intentioned. It provides for enhanced penalties, for example, for trespassing on critical infrastructure during times of a declared emergency. And I don't think the legislature understands that we've been under a declared emergency continuously now for years because you have to renew emergencies anytime there are outstanding funding obligations, for example. So I think it's literally the case that if you go back to Hurricane Katrina, for example, I think we've been under a declared emergency
since then.
Yeah, and so I don't think the legislature intended that result, and so, but we're taking a good hard look at it, and I don't have a specific announcement today other than to let people know that I am looking at that bill very carefully.
Okay, Tom of New Orleans says, do you think with social distancing that it's safe to have Mardi Gras without a vaccine? Is it safe and responsible to have thousands pack Bourbon Street and cram bars and packed together on parade routes and floats? Organizations work months on planning and putting out money. It seems a decision can't wait until November or December. It could cost crews financially. Wouldn't it be better to just tell them to skip a year? There's a lot of people ask a question and then tell you what they think the answer should be.
I think,
but you're the governor.
I think the way the question was asked suggests pretty strongly how that individual feels. I am just not yet, here we are on the 11th day of June, and I'm not yet prepared to say what the world is going to look like in January and February of next year. And I think it is way too early to engage in that. I understand that there is some risk associated with planning for and perhaps paying for some of the things that are attendant to, related to, I should say, Mardi Gras of next year. But I just don't have that answer. And the other thing is, I am not about to go out and get in front of the mayor on that. This is something that obviously as we get closer in time and we know what the circumstances are, you can anticipate that there will be some engagement about this, but not just this, other specific events as well.
Okay. Is there any state role? I mean, Mardi Gras is mostly in New Orleans, but in some other parishes, or, is it your view that this is a parish leader's decision about whether a Mardi Gras occurs in their parish?
Well, typically, I would issue proclamations that have statewide effect. There are Mardi Gras activities around the state of Louisiana, but when you look at the totality of them, obviously the Orleans Parish, Jefferson Parish events are by far the largest, the most expensive, those with the most people, and so forth. And so any decision like that, and certainly any announcement, needs to be made after there's a lot of close coordination between the mayor of Orleans and the president of Jefferson Parish, and I will certainly be part of that. It's just too early to venture a guess.
Okay. Christine of Mandeville says, can school-sponsored dance team practices begin with modifications for social distancing?
Yeah, and I don't know the answer to that. I believe the answer is yes. We are allowing sports activities to move forward this summer, but non-contact sports. And so I don't know, when you say dance team, I really don't know whether that's akin to a contact sport or not. And that's why I hesitate to answer. But we know that, for example, softball and baseball tournaments are happening now. And so those types of athletic events can proceed. It is very important that social distancing take place, that people make sure that they're washing their hands frequently and all of those sorts of things. And to the extent, and I say this often, to the extent that they can have that activity outside rather than inside, that's better as well.
Alicia from Marrero says, when I go out to the store, I see a lot of people not wearing their mask in public places. Sometimes I feel like the odd person for wearing my mask. If social distancing and mask wearing is helpful in keeping down the virus, why don't you make it a requirement to wear a mask inside public places?
Yeah. Well, first of all, I want to thank her for wearing the mask, and I do hope that more people will choose to do that. Quite frankly, those states that have tried to mandate mask usage have quickly rescinded that part of their order. It becomes an enforcement issue, and so we just have to try to appeal to people's sense of neighborly love, if you will, because when you wear the mask, you are protecting others from yourself, and when they wear a mask, they're protecting you from them, because we do know that the vast majority of transmissions happen because of aerosol particles of the virus that are made airborne because of somebody speaking, coughing, sneezing, that sort of thing. And that mask really cuts down on the distance that aerosol will travel. And I want to make a point here. If people wait until they don't feel well to put a mask on, there's a great chance they've waited too long, because 25 to 40% of all the people who have coronavirus and are going to get it never become symptomatic. And then for those who do become symptomatic, they became contagious 48 hours before they became symptomatic. And so if they wait until they don't feel well to put a mask on, if they think, well, I don't have to wear one because I don't have coronavirus, that's really illogical. That's not what the science is. That's not where medicine is these days. And so we're encouraging people to wear the mask. It is incredibly important as we bring more people into stores, whether they're customers or employees, get more people back to work and get people traveling and in contact with one another. The way we will keep our cases down is through testing, contact tracing, but also, very importantly, wearing those masks and face coverings, washing your hands, and staying 6 feet apart.
Yeah, okay. This comes from Jake in Metairie. He says, when will phase 3 begin? Our local economy cannot bear many more weeks of being stagnant.
Well, first of all, I can't tell you when phase 3 will begin. I can tell you phase 2 will last at least until the 26th of this month and of June. And we are going to continue to look at the data, make sure that we satisfy the gating criteria to move forward. Those criteria are COVID-like symptoms upon presentation to an emergency room. There are cases, so both in the raw number of new cases of COVID-19, but also as a percentage of all tests administered, so the positivity factor there. And then hospitalizations. What do your hospitalizations look like relative to your capacity to deliver care to individuals who need it because of COVID-19? Those are the criteria. I don't have 14 days worth of criteria of these data until I get there. And so I can't announce yet when we will move to phase 3. It is potentially possible to do it on the 26th of this month. And look, I understand that this is tough. We have a public health emergency. We do have an economy that we want to make sure that we move forward as quickly as we can, but balancing the need to protect public health. And I would like to point out that unlike many other states, and in fact, there was no state that had anywhere close to our per capita caseload who took the approach that I did, where I never closed manufacturing. I never closed construction. I never closed non-essential retail. Everything that the cybersecurity, cybersecurity and infrastructure security agency out of DHS designated as essential, we accepted that, and so we've done I think as good a job as we could under the circumstances of keeping as much of our economy open as possible and reopening as quickly as we can when we meet the criteria. We're going to continue to take that approach going forward, but I can't make an announcement today about exactly when we get to phase 3.
What does phase 3 allow
Well,
that phase 2 doesn't allow?
Yeah, well, it's just going to be a further easing of restrictions. So you're looking at occupancy limits and types of businesses that and there are only a few left, for example, that can't open at all. And in fact, what we did in phase 2 is any business that cannot open, they are able to submit a plan to the fire marshal's office that will be reviewed in partnership between the fire marshal's office and the Office of Public Health to give them individualized consideration as to whether we believe that they can reopen safely. So I would imagine that in phase 3 we will have a further easing of the restrictions on occupancy, for example, and other activities. You know, we were talking about dance teams and so forth. You know, are we able to get to contact sports, for example? It's all of those types. Trust me, there there are way more factors and things to consider than you can imagine when it comes to exactly what you're going to allow every time you move to a new phase.
And is phase 3 the last phase, meaning that after phase 3,
Yeah.
there are no restrictions?
Well, if you look at the White House plan, after phase 3, you're just back to normal, and as best you can be normal, and so I think that's a fair way to describe it. Yeah.
So phase 4, there is no phase 4. There's
Not, well, I'm not going to say that some states haven't, or that the federal government won't come back and say, look, based on what we've learned and additional things that we've taken into consideration, we think there should be a phase 4. But right now, it's really 3 phases, and then you ease all the restrictions.
I see. Coming back to one of the earlier questions, what happened in the states that required masks that caused them to rescind it or that didn't
Well,
work out?
you had people refusing to do it, and in numbers that you just weren't going to go and have police interact with those people and issue citations and so forth with the frequency that it was happening. And that's why I have said from the beginning, Peter, when you start putting these restrictions in, whether they're occupancy restrictions, physical distancing restrictions, you're not going to enforce your way through it. We have 4.7 million people, tens of thousands of businesses. We've got 5,000 churches. I mean, we're asking for people to comply because it's the right thing to do, and quite frankly, the reason we made as much progress as we made, as quickly as we made, is because the people of Louisiana did take it seriously. The challenge is keeping that constant vigilance up over time, because as you start to do better, people think the risk to their safety and that of their family is diminished enough that they can ignore some of these things. But the fact of the matter is there's still an awful lot of COVID in Louisiana, and there is a risk to individuals.
Yeah. This is from someone who calls themselves a volunteer contributor, and they asked, they said medical grade PPE is still lacking in both quality and availability, and industrial grade PPE is in short supply in stores, causing health protection issues for medical, occupational, and home use. We need to have PPE protection seriously and urgently restored to pre-COVID levels. Are we having problems with that in Louisiana?
Well, I'm not going to say we don't have problems. I will tell you that compared to where we were just a few weeks ago, we are much, much, much better. The shortage areas have been different at different times. I think the mask production has pretty well caught up, at least in terms of the N95 mask. Then we were having a problem with surgical gowns. I think that's better now. And now we're having issues with the gloves. But we are much better than we were before, and as of right now, we have a fairly decent stockpile of various essential elements of personal protective equipment that we can continue to draw upon to meet the demand now. But if there happens to be a surge in cases and more people presenting to the hospital and so forth, like we were seeing a couple of months ago, we can draw from, at least initially, from our own stockpile in Louisiana.
So one of the things hospital executives told us early on in this was, you were having bidding up of prices for these things, and you'd have Ochsner bidding against Houston General Hospital, and has that
And against FEMA,
Yeah,
and
and
against the state of Louisiana.
and has that gotten under control?
Yeah, well, it's much better, and so it's the law of supply and demand, and it was just another instance of it. And it wasn't just that Louisiana needed it. Every state in the country needed it. Most of the countries in the world, all at the same time, trying to buy the same things. And when that happens, the prices go up. And so we were able, ultimately, to get FEMA to play a much larger role in directing the allocation of resources and so forth. And now things are better. The availability is there. The factories and manufacturers, I should say, they really greatly increase production, and there's more of an organized marketplace, and so the prices have come down.
Nick from Baton Rouge says, is the reported increase in COVID cases the expected result of increased testing, or is it because we really have more COVID?
Well, it's some of both, actually. And I mean, you know that if you greatly increase testing, that you're going to find more cases.
Right.
And so we are seeing some of that, especially when you go into congregational settings. So if we test 100% of a prison dorm or a nursing home, you're gonna test a lot of find some people who are positive, but there's a good chance that those positives are also asymptomatic, which is good for them, but they can still be contagious, and so you still have to identify that. And so we're seeing all of that. The good news is we have a test goal of 200,000 tests per month. We met that in the month of May. We're well on track in the month of June to do it again. And we're not just having the goal for the state as a whole, but we have minimal goals for every single parish and every region of the state. And so we've got testing out in areas today in a robust way that we didn't have it before. And so you're going to find those cases, but it is also true there's still community spread, and so that's the difference. Some of this is in congregant settings, some of this is in the community. Obviously, if it's in the community, it poses a bigger threat to the community, and so we're worried about all of it. But at the end of the day, we're still are doing much better as a state than we were before. We do have those three regions that we're paying particularly close attention to, though.
Yeah. Okay, this doesn't relate to the questions, but it did come up. I'm told that your office issued a statement on the library naming at LSU, and since people are watching, maybe you could share that.
So I know that last night LSU's leadership, I think it was the board, announced the process of finding a new name for the Middleton Library, and you know I think that's appropriate. I support that move. I know it's important to an awful lot of students at LSU, especially African American students, because General Middleton, while he had a very distinguished military career and many contributions in that regard, he was also an avowed segregationist. He made it very clear, and that segregation is rooted in racism. And so as we move forward, I think the most important question is whose name should be on the library so that it represents what we aspire to be and what we want our young people who are going to go to LSU to aspire to be. And now with what we know about General Middleton, I don't believe it's appropriate that his name stay on the library. And so they're going to move forward and find a more suitable name for that. I think that that's the appropriate thing.
Yeah, I see. What about a new? Some people would say the real problem at LSU is that they need a new library.
Oh, there's no doubt. And this is something that I've been speaking about since before I was governor. Actually, it's a very expensive proposition. But if you go there to look at just the physical condition of the library, it really needs prompt attention. And the master plan for LSU is to have a new library and restore the space where Middleton sits to green space, which is what it was always supposed to be under the master under the master plan. That is an expensive proposition, but it's one that I'm working with the board and with the legislature to see just how soon we can get a new library at LSU.
Okay, well, I wanted to close out. Smiley Anders has a couple of questions
Always
for you.
Smiley, okay.
You know, his first question is, you know, you've dealt with a pandemic, you've dealt with a tropical storm, and you know, we've had plans for tropical weather. We're used to it. Do you have a plan for locusts if that should happen?
You know, I say that only in jest. I saw a news report the other day that the cicadas came out in the Washington D.C. area, and the locusts were somewhere out overseas. And I'm thinking it may just be a matter of time before we have them here in Louisiana. I'll get GOSEP working on that.
Okay, well, you need to. You need 3 phases too of what you're going to do about it. The last Smiley question is, with so many legislators in favor of allowing churchgoers to carry their guns to worship service, it seems logical that they would also support the same right being extended to the legislature. Do you favor arming our lawmakers?
I do not. I think this ought to remain one of those buildings where we don't have individuals with concealed carry rights in the legislature. And by the way, I don't think, and the law is that you don't have that in any municipalities or parishes where you have governing authorities that are holding meetings as well, because I've seen the tempers flare firsthand. But it is a good point.
Okay. Well, thank you for coming out today. Hopefully, we'll do
Thank
this
you, Peter.
again in Phase 3. Hopefully, we'll have Phase 3, and we'll do this again in Phase 3, and maybe we'll both wear seersucker suits. And,
Thank you.
We also want to thank AARP, our sponsor, and thank every one of you for joining us today.